Congenital disorders of glycosylation, or CDGs, are a large group of more than 170 rare genetic disorders caused by impaired synthesis of sugar structures called glycans. They are mostly attached to proteins and lipids through a process called glycosylation. Unfortunately, patients affected with CDG often undergo a diagnostic odyssey. Thus, clinical suspicion and adequate diagnostic testing are necessary. Although CDGs are clinically heterogeneous, most CDG patients present during early infancy or childhood with multi-system diseases including liver and neurological involvement, ranging from mild to severe on the clinical spectrum. Neurological signs and symptoms include developmental delay, cognitive impairment, hypotonia, ataxia, microcephaly, seizures, peripheral neuropathy, and stroke-like episodes, with some types of CDG presenting with brain malformations. Also, poor growth, immunodeficiencies, skeletal dysplasias, problems such as clotting or bleeding, muscular dystrophy, and heart disease can also present in certain types of CDG. Nonetheless, suspicion of a CDG should be considered and ruled out in any neurodevelopmental and/or multisystemic involvement in phenotypes of unknown etiology. If you're a clinician that suspects that your patient could have a CDG or have received biochemical or genetic test results that confirm or strongly indicate it, we recommend the following. If you are suspecting CDG based on the clinical presentation, you can proceed to screen using the available biochemical test. One of the most reliable is carbohydrate deficient transferrin test, or CDT. Nonetheless, some types of CDG do not show alterations by this test, so it is important that you review the literature to determine if other biochemical or genetic tests are required for your patient. If you receive abnormal results from biochemical tests that screen for CDGs, it's important that you proceed to confirmatory genetic testing. In many cases, the results from the biochemical test will allow you to determine the type of genetic test that is needed, including single-gene sequencing or next-generation sequencing panels. Another option, particularly if the biochemical tests are unavailable, is to request genetic tests based on next-generation sequencing, such as the CDG gene panel or whole exome sequencing. Now, whole exome sequencing might be the best, as several genes are being discovered for this group of disorders, and the panel might be outdated. In case that you have already received genetic test results that allow you to confirm diagnosis of a type of CDG, it is important that you determine if there is a specific treatment, such as monosaccharide supplementation, as this can be life-saving and the basis of an improved quality of life. Also, some types of CDGs have clinical management guidelines that can help you make expert-based decisions. In case you have received a genetic test result that does not allow you to confirm a CDG diagnosis, but do indicate a strong suspicion of CDG, such as the presence of variants of uncertain significance in CDG-associated genes, we recommend you contact a clinical or research laboratory in your region specialized in CDG. They can help you establish the following confirmatory test. This website contains a list of CDG clinical ambassadors for your region that are also members of the FCDGC, and they can help you navigate through the diagnostic process. It also includes a list of regional laboratories that you can contact to request a CDG test.